All right, welcome back. Thank you for being here. I hope that you found yesterday very informative and you learned a lot. So today we're going to go into day number 2, and the focus is going to be about strategies. So we're going to focus more on thinking more critically, answering questions, and we may actually even do a case study question to help you to start to prepare for the next gen. Hopefully you're not taking that one, but we will do that tonight too. So we're going to go over SATA, and I'm going to provide some definitions, and hopefully we'll do plenty of questions as well. So so tonight's going to be way more interactive, more questions. I'm probably going to have to open up the chat so that way I can be able to see your answers as you're putting it in the comment. But it's going to be way more interactive because we're going to do a lot more questions, okay? All right, so here's what the NCSBN says about SATA, right? This is prior to next gen, but it says that there's no established percentage of items with alternate formats. So the exam, it typically calls SATA questions alternate format questions, but it also can refer to as SATA questions too. And it is computer adaptive, and the items are based on the candidate's ability. There are alternate item types in all areas of the test plan across all difficulty levels. An alternate item format is an exam item or question that uses a format other than standard 4-option multiple choice items to assess the candidate's ability. Remember, it's all about assessing your ability. That's why it's a computer adaptive exam. So an alternate item format is an exam item or question that uses a format other than standard 4-option multiple choice items to assess candidate ability. Alternate item formats may include, once again, this is still pre-next gen, multiple response with single correct response, more than one correct response, and then all of them being correct. So meaning that you can pick all the choices for it to be correct. Fill in the blank. So that's going to be like calculation questions. So hopefully you understand how to do dosage calculations, drip factors, that type of stuff. Hotspot items, that can be where you have to select like a picture or a graph. Chart exhibit, this is where you'll be presented with a problem, and then you have to read the information, and then in the chart or the exhibit to answer the problem. Ordered response, that's your drag and drop. So those are the questions where you have to put things in a very specific order in order to get the right answer. Audio item format, that's where for this one, the candidate is presented an audio clip. You have to listen with headphones, and then you pick the correct answer. So that could be, usually that's going to be like lung sounds, heart sounds. So you should feel comfortable being able to differentiate lung sounds at minimum. It will be less likely it will be heart sounds, because even a lot of nurses that are trained can't hear a murmur because it's hard to detect, to be honest. And then graphic options that present the candidate with graphics instead of text for the answer options. And they will be required to select the appropriate graphic answer. So what I will tell you with SATA, because I know for a lot of people, it's an area that they feel the least confidence in. And it's more about understanding the content than it is about critical thinking. All right. More about content than it is critical thinking. And there's a heavier focus on really you understanding the disease processes for it to really make sense. So what we'll do is I'm going to go over some different strategies. So make sure you take a note of them and you can start to apply them right away. And this is actually the same training or part of it, because I did a little bit more before, but this is the same training I did with other students where we did like a SATA training, and I went over all these strategies with them too. And I just had a student, another student who just told me she just passed her RN exam going through this same training. this same work teaching I'm giving you right now. She just passed her RN test. So listen intently. Don't leave the class. All right, stay until the very end so that way you don't miss anything. Right? If somebody calls you, hang up on them. All right, put away your social media, all that stuff, so that way you can be glued in. All right, glued into this information because it could literally change your life. Tonight's training, yesterday was just the beginning, right? Tonight's training could literally be the thing that shifts you 6 months from now, a year from now. Okay. Okay, so here's a question on the screen, and I want you to do your best to answer it. It says the nurse is taking care of a patient with a diagnosis of leukemia and is currently on neutropenic precautions. Which of the following interventions would the nurse apply? Select all that apply. Is it going to be A, avoid fresh fruits and plants inside the patient's room? B, notify the unlicensed assistant personnel to wash their hands before and after? C, restrict all visitors from entering the room until precautions are discussed? D, place the patient in their own room? Or E, have the patient wear a mask at all times to reduce incidence of infection? So take your time, and then when you're ready, comment what you think the answer is. Okay. Oh, I was trying to do something at the same time, but it didn't work. All right, let me see. I think I saw A, B, C, D, E. Okay. All right, let me see what the answers are. Oh, I know what to do now. Okay. Oh, okay, there we go. A, B, D, oh, A, B, A, D, E, A, B, D, B, D, E, A, B, D, E. Wow, a lot of different answers pretty much. A, B, C, A, B, D, E, A, B, C, D. Yeah, so it looks like a good mixture of answers. Okay, so let's go ahead and break it down. So one important strategy. So for a lot of times when you're doing practice questions, you gotta really pay attention to strategy. You gotta because you have to evaluate, why did I choose that answer that caused me to get it wrong or right, right? And so that's why like knowing strategies is so important. So the first thing is that you should always watch out for absolutes or extremes. Absolutes or extremes. So anytime it says at all times, all the time, any type of complete restriction, because these are oftentimes the wrong choices, all right? So watch for absolutes or extremes. So here's how that applies. So looking at this question, right, because it talked about they have leukemia, there's on neutropenic precautions, and now it's asking you what would be appropriate, right? And it's a SATA question, which is likely more than one answer. So for this one, the answer is A. So A is included because they should avoid fresh fruits and plants. So with patients that have leukemia, what are they? They are immunocompromised. So when they're immunocompromised, there's a higher risk for infection. So that's why they're on the neutropenic precautions. So, and then we have notify the unlicensed AAP to wash their hands. They should definitely do that. C says restrict all visitors. So everybody, like every single person can't come in the room. That's what that's saying when it uses the word all. And then D says place the patient in their own room, right? In their own room, which is good. And then E says have the patient wear a mask at all times to reduce incidence of infection. Well, you wouldn't, that means that they need to wear a mask when they're in the bed, when they're in the room, when they're by themselves, when they're sleeping. That's what that's saying, right? So you have to think through in your mind the what that would look like in the real world as far as like the application of the answer. So the best answer is going to be, let me go back, B, A, B, D, and that's it. A, B, D. All right, A, B, D, because you wouldn't restrict all visitors, but you would screen visitors and limit the number of visitors the patient can see. Patients on neutropenia precautions don't have to wear a mask at all times, just when they step out of the room, right? Just when they leave the room. That's the only time they actually need to wear a mask. So you have to really be careful to watch out for those type of like keywords. And that one thing I often tell students is that if one word is wrong, unfortunately, it's all wrong. So you have to be pretty meticulous with SATA questions, especially, right? If one word is wrong, it's all wrong, right? So let me see who got that right. I think I saw. Okay, so you got that right. Good. A, B, D. Oh, you changed your answer. So I think I saw like a couple people got it right. Yeah. So it's kind of hard, right? Just because that keyword that you have to pay attention to. So you got that right, Dante. I saw it. Good. Okay, yeah. Some of you guys missed it. All right. Hey, Nicolene, good to see you. Okay, all right. So now let's go on, right? So hopefully that makes sense. So pay attention to those words that limit, that says it's always, because that means that you're taking away judgment and you're not looking at things from a case by case basis. Then the next one says, a patient is admitted to the hospital with suspect polycythemia vera. Which of the following symptoms is consistent with the diagnosis? Select all that apply. A, weight loss. B, hypertension. C, increased clotting time. D, headaches. All right, so go ahead and think about it, and then I'll give you a minute and post your answer in the chat. Okay. All right. Okay, let me see what y'all got. All right, so I see A, oh wait, hold on. B, C, D, B, C, D, B, D, A, B, D, C, D, A, C, D, C, D, B, C, D, and B, C, D. Okay. All right, cool. Okay, so for this one, the next thing, when it comes to the second strategy, is that you want to check if the answers relate to each other or if they are the opposite. Check if the answers relate to each other or if they are the opposite. So to realize that, you have to think like of the patho, the body, right? So what that means is that think about, the question said polycythemia vera. polycythemia vera. So sometimes you're not going to always know the diagnosis. So what you have to do is that you have to break down the word, right, into the suffixes and prefixes using medical terminology. So if it says here emia, what does emia remind you of? EMIA. What does EMIA remind you of? Red blood cells, right? Like anemia and etc. So the word emia means, the suffix means red blood cells. And then the word poly means a lot or too many. So essentially they have too many red blood cells, and that's polycythemia vera, right? So now you think, okay, that means that this is a cardiovascular problem. This is a circulatory problem, right? So even if you were still in the dark about what the diagnosis is, you could still make a pretty good judge of that based on the body system, because that has to do with the cardiovascular system. Then I would go back and then I would go and look at the choices and see, okay, between all these choices, which of these options relate to the cardiac system and which one does not. And that's one of the best ways that you can eliminate the choice in the event you have no idea what the diagnosis is. So if I was to do that, I would look at it, I'm like, okay, weight loss can vary, but usually weight loss, unless it's because they have cancer or something, it's typically going to be a digestive issue. So something involving the digestive system. But all the other choices, hypertension, clotting time, headaches, those all have to do with the cardiovascular system. So even just by default, even if you weren't totally clear with what the answer was or what the diagnosis was, you can make a pretty good deductive reasoning that it's B, C, and D just by doing that, right? So that's the strategy, is to check if the answers relate to each other or not. Now, the true rationale, right, is that it is B, C, and D, because polycythemia vera, it is a bone marrow condition where the body creates too many red blood cells. And what that does is that it increases the hematocrit of the blood. So when the hematocrit of the blood is higher, then the blood is more thick. And if the blood is more thick, then the pressure will increase. And if the pressure increases, then they're going to have higher blood pressure. If they have higher blood pressure, they're going to have headaches. And as well, if the blood is thicker, they're going to have an increased risk of clotting time, which means that they'll be more likely to develop blood clots. So what I showed you was, the first one was me explaining essentially what, how to break it down, like the keywords and suffixes. And then the second, what I just said right now, was the actual true rationale to the answer. So you see that? So you see how if you analyze it, that can make a huge difference. And a lot of times, I've had students that literally they pass their test just by implementing that strategy alone, by looking at the suffixy, the prefixy, and using medical terminology and making a guess and choosing it that way. So sometimes for some of you, you may want to consider, especially if you've been out of school for a while, or if English is not your first language, reviewing medical terminology. Just being able to evaluate what different medical terms means broken up. All right, the third strategy is focus on understanding the concept. Focus on understanding the concept. So a lot of times, the reason why static questions are really, challenging is because it's honestly testing you to see how well you know the material. Like how well you really know the material for real, right? So this is what it looks like. Let's look at this question right here. It says a patient has CHF. What symptoms would the nurse expect the patient to have? Select all that apply. All right, so I'll give you a minute and then comment what you think the answer is. Okay. All right, let me take a look at these answers. A, B, C, D, A, B, C, D. Okay, most of you guys are putting A, B, C, D, and then I see one person putting all of the above. Okay, all right. Okay, so this one, A, B, C, D, huh? All right. Okay, so this is interesting, okay, because it's saying, what I'm gonna do, I'm gonna highlight for you the keywords, all right? So when you're looking at questions, you have to stop and evaluate what are the keywords in the question. What are the keywords? Okay, so for this one, we have, it says swelling. I'm sorry, for this question, I should say, it says CHF and then it says expect. That is very significant. Not could, not potential, but expect. That means something totally different. So that means when it uses the word expect, then it's implying that they always have X, Y, and Z symptoms with this diagnosis. Every single time, they always have these symptoms. That's what it's saying. So you have to choose the answer based on the true definition of the diagnosis. So A says swelling, right? So think about what's going on with patients at CHF. They have a problem with the heart not pumping well. So there's a fluid overload issue. They have too much fluid in their body. So A says is swelling, right? B, irregular heart rate. C, shortness of breath. D, weight gain. And E, headache. Let me show you guys what the answer is. It's actually A, C, and D, not B. A, C, and D. Here's the reason why it's not B, okay? So the core problem with heart failure, like I mentioned, is they have too much fluids. Irregular heart rate means that, and for somebody to have an irregular heart rate, that's usually atrial fibrillation. That's a type of rhythm. Okay, so you have to pay attention to when you use, there's a difference between having a elevated heart rate. That's one thing versus having an irregular heart rate. So that means that the rhythm is not regular. That means the R to R when it comes to EKGs is not always the same. And that's consistent with, like, for example, atrial fibrillation. So if when you choose B, you're inconsistently saying that they always have AFib with CHF because the word is saying expect, but they don't always have it. It could be a complication down the road, but it's not always the case. So you have to pick the answers that reflect a fluid overload issue, which is the heart failure, which is the core meat of the problem, swelling, shortness of breath, and the weight gain, and that's it. Not irregular heart rate. You guys see that? You see why it's just only A, B, and D, or I said A, C, D. It looks all too tech. It looks all too what? Edema on the leg. Wait, say that one more time. Right. So yeah. So that's why it's just only A, C, and D, because they don't always have a regular heart rate. Now they can have AFib as a complication, but it's not the symptom that they always have. Right? Does that make sense? So it's not where like it can be a complication. A lot of patients that CHF do eventually, if it doesn't improve, they can develop AFib, but it's not a sign or symptom that you automatically expect because they have CHF. Was there supposed to be headache due to pressure and shortness of breath? No. So this situation, no. So for example, they do have, so shortness of breath. Here, let me show you the answer one more time, so you can see the answer on the screen. All right. And sorry, because the reason why I flipped the screen is because I can't see the chat and the screen at the same time. So I have to do that, that's why. But yeah, so shortness of breath, yes, because of all the fluid. Headache, no though, right? So they don't automatically always have headache when they have CHF. This is actually, this is what this wants you to see. What this wants to see is if you understand the underlying pathophysiology with CHF, and that is too much fluid. But they don't always automatically have headache every single time they have CHF. They can have it, but um, it's not expected. Like I hope that I'm explaining it as best as I can. The point I'm trying to make is that like when you use the word when they use the word expect, that means okay, if they have CHF, they always have headache. You probably think of hypertension. That's what you're thinking about. Hypertension, they may result in having headaches. That's a common symptom associated with hypertension. But with CHF, it's not consistently all the time. So look at this photo here. Take a look at this picture here. So typically the way that CHF progresses is that they have high blood pressure, then they have a heart attack. Then the heart attack results in the heart failing. So failing in the heart pumping. So there's no pumping, which means that it backs up fluid in the lungs, edema, right? Then they have issues when they lay flat at night. So they have to increase the head of the bed, and we have to give them diuretics in order to remove the fluid. So that's a concept that's showing you the overall picture so that you can better understand the diagnosis. So take a look at this photo here at the bottom. That's kind of showing you an example of a patient with CHF, how their feet are swollen, how they have to sit up at night, and everything. This is showing you concept. So when you understand the bigger picture, everything will make a lot more sense. Okay, awesome. Okay, good. Okay, all right, so here's the next question. This is a drag and drop, right? This is a drag and drop. What is the correct order of insulin? What is the correct order of insulin administration? Take your time, read each of them, and then put your answer in the chat. Okay, so let me see what you guys put in the chat. We have B, D, E, F, A, C. I see D, B, F, E, A, C. D, B, E, F, A, C. D, B, E, F, A, C. D, B, F, E, A, C. D, B, F, E, A, C. D, B, F, A, C. Okay, so different choices. Okay. And then, so most of you started off with D, and then a couple people started off with B as in boy. All right, so let's go over which one it is, and then why it's the one that it is. B, F, E, A, C, D. Oh, you just changed your answer? D, E, B, F, A, C. Okay. Okay. So let's talk about why it is the correct order that is. And once again, you have to kind of like imagine a situation. Okay. So, man, I wish I had an insulin in front of me so you can see. All right, but anyways, okay, so you have to always, when you're studying, so when you study like later on your own time and you're looking at content review, always look and identify the step-by-step or order of a process. All right, always look and pay attention to the order, because a lot of times the answer choices reflect the order of a process. Right, so touches like, for example, mixing insulin, putting a Foley in, all that type of stuff, that could be on the test as drag and drop. So here's the answer, and here's why it's the answer. D, B, F, E, A, C. D, B, F, E, A, C. Let's go over it. The first thing you're gonna do is that you're gonna get the glucose first, all right? I'm gonna tell you why you get the glucose first and not check the order first, all right? So most settings in the hospital setting, you give insulin only based on the glucose amount, right? So for example, what we'll do is I will go and grab our glucometer, right? We'll talk to the patient, hey, I want you to check your blood sugar, wash your hands, all that good stuff. And then we'll go up to the patient, and then we'll check their glucose level and everything. And if their sugar level is, let's say 72, why do I still need to verify insulin order? No, right? There's no reason for me to look at insulin because that is normal, right? So you have to, that's why it would be that you would check the sugar first and then you would check the order. So if, for example, if it was the other way around, for example, if it was, okay, let me look at the order and then check the glucose, you have to give the insulin only based on whatever the glucose is, not the other way around. That's why D is the first answer. So I would check the glucose. So now let's say the glucose is instead like 202 or something. Then I'm going to look at the order, and the order is going to tell me, okay, if the sugar is from this range to this range, give this amount of insulin, right? Usually, so it's like parameters called sliding scale. So I'm going to verify the order with the glucose that I just got. That's why you have to do that first. Then I'm going to go ahead and draw up the insulin. All right. So I'm going to grab my insulin based on the order, right? Humalog R, Humulin, whatever it is. I'm going to draw it up. And then I'm going to go ahead and grab another nurse. So although the picture, the woman in the photo with the insulin and everything, it's not the correct vial or anything like that. But you see how she's holding the insulin, or she's holding the vial, and the needle is still in the vial. So technically that's the correct way that you're supposed to verify with another nurse. You're supposed to have the insulin along with the amount in the syringe that your body gives, so that way the nurse can see, okay, the glucose level was this amount. I'm giving this type of insulin. Here it is in my hand. Here's the amount I'm giving based on the order, and I'm giving it to this patient. Correct, right? So You would then verify with another nurse. Then once you verify it, then you go over to the patient. The nurse says, okay, good, looks good. That's the correct amount. That's the correct order. And that's the glucose. Perfect. All right, go ahead and do it. So then you go to the patient, you wipe their skin with alcohol, and then you go and inject the insulin. That's why it's DBFEAC. So if you imagine it out and you understand the normal nursing protocols would give you insulin, you'll see why it's, clear why it's that as the answer. That makes sense? See that? So you sugar first, then order. Sugar first, then order. Okay, I'm not seeing any comments. So let me see here. Okay. Yes, okay. You got them right so far? Oh, good job. Oh, you're doing good. That's awesome. Okay. All right, here's another one. This one's a little bit more trickier. It says the clinic nurse is assisting to perform a focused data collection process on a client who's complaining of symptoms of a cold, cough, and lung congestion. Which of the following would the nurse include for this type of data collection? Select all that apply. So take your time, look at it, and then comment what you think the answer is. Okay. Okay, so let's see what y'all got. One, two, four. 1, 2, 4, 6, 1, 4, 6. 1, 2, 4. I'm moving around. 1, 4. 1, 2, 4. Okay, so it looks like it's mainly 1, 2, 4, 6, and 1, 2, 4. Wait, no, and 1, 4, 6, 1, 2. Okay. 1, 2, 4, 1, 2, 4, 6. 1, 4, 1, 4, 6, and 1, 2, 4. Okay. This one's gonna really take you. This one may shock y'all a little bit. Okay. This one may shock y'all a little bit. Okay. All right. So for this one, what are the keywords? Boom. What are the keywords in this question? You have to. That's the first place you have to kind of start off with is look at the keywords, and then from there, it will make the answer really obvious. That's what I teach over and over again, is helping you to evaluate the keywords. So it says focused, right? Focused, it doesn't just say data collection. It says focused data collection. That's really important. Okay. And then it says cold, cough, and lung congestion, which sounds like what? Respiratory problems, right? Maybe a respiratory infection. So you have to really pay attention to those keywords because the keywords is going to make or break, well, let me say break you, but the keywords are really going to make a difference with picking the best answer. So the fifth strategy is to not read or overthink the questions. Once again, it's more about facts than it is about critical thinking. So you have to think more, is this true or is it not true? That's what you have to ask yourself. So looking at this, focus data collection, cold, cough, and lung. Correct answer is 1, 2, 4. Boom. Wow, right? 1, 2, and 4. Here's why, because I know a lot of you were thinking, oh, let me add 6 too, right? So it says focus data collection. It doesn't say complete or total. So that's why whenever you see that, you should automatically be thinking, okay, that means I have to pick, I have to pick very specific answers. So it's 1, 2, 4, because we're looking at the chief complaint, which is respiratory issue, a possible infection. A complete data collection would include 6, but it's not complete. This is focused. So you don't need the complete health history, the physical exam, no to the peripheral pulses, nope. That's a vascular assessment. Musculoskeletal neural exam, that's also not part of the chief complaint. And then also, like I mentioned, the strength of peripheral pulses, all that is complete data collection. Same thing with asking them for the family history of disease. That's all complete assessment, not focus assessment. So that's why it's 1, 2, and 4. You guys see that? You see why it's that now? 1, 2, and 4. So you have to break it down by look at the keywords and then answer the question. If you do that, man, your life will be changed. You'll feel less intimidated when it comes to these type of questions. Okay, let me see what y'all put in the chat. Yes, got it. You was confused. Okay, you was confused about 6. Yeah, because like I said, it's not 6 because 6 is part of complete assessment. It's a complete when the answer is asking you for focused. I only pick 6 as well because when I do focus assessment in the office, I ask the patient on recent. So here's the thing, because I know that's the thing for a lot of us, is like it's really easy to pick the answers on NCLEX questions based on your work experience, based on what you currently do or what you witness, etc. But remember that you have to pick it based on the NCLEX, not based necessarily on your own work experience. You have to be careful about not inputting your work experience to pick an answer. You have to honestly pick it totally based on the NCLEX. Otherwise, it's going to be hard to pick the best answer. Yeah, so that's the reason why with focus, for the sake of this test, for the sake of the NCLEX, when you ask, I know in real life, right? But technically when you're well, I'll just say it like this. I know in real life, you probably would ask more, you want all the information, but for the sake of the NCLEX, because it's using the word focus data, you have to focus in on the respiratory issue, and a complete assessment or the medical history and stuff, that's part of it, or the family history, that's part of a complete assessment, full admission, everything. That's not necessarily focused in on the respiratory issue. So I hope that kind of clarifies things. All right, you're welcome. Good. All right. So yeah, so that's a common thing, but just be aware of that. Okay. All right. Oh, let me share this testimony with you guys real fast. This is one of my students that passed her NCLEX exam. This is Corinne. So when I met Corinne, she was living in the Philippines, and she had taken her test. It was like about one time. She'd been out of school for 8 years, and still wasn't able to pass her test yet. And she was frustrated, discouraged, like, what am I doing wrong, type of thing. So long story short, we decided, I told her I can help her You know, we talked. I worked with her we actually worked together for 2 months, which is not always typical. It really is about a matter of how much energy and effort you put in. So because she studied on average about 20 hours per week. And she went through a lot, like, because sometimes honestly when you're trying to get to this path as far as becoming a nurse, it seems like all of your life would just go into chaos. You know, so like all these things will happen. And so, not to share too much of her details, but essentially like she went through a lot of things that was going on behind the scenes while she was still pushing forward to pass her exam. And after about almost 60 days, she took her test and she passed her exam in 75 questions and 35 minutes. That's the total time it took her to take the test. Half an hour. And she passed the 75 questions. Why? Because literally she was getting it, right? She was seeing the questions, she was making the connections, she was seeing the pathos, she was getting the bigger picture. You know, we went through all the information, everything, and she got it. And she sent me this email. She said, I did it, Nurse Choma. I passed the NCLEX exam. I got a notification from the state of Oregon, and now I'm a licensed nurse in Oregon. So this is huge because thank you. She says, thank you so much for your help. Praise be to God. Because like she went from living in the Philippines and less than 90 days later, she was now moving to Oregon, paid, which is a huge jump because the cost of living in Philippines is not like at all, nothing like the US. Nurses don't make that much money in the Philippines. They make very little. And the cost of living out there, I think is like $500 to $1,000 a month US. So like her salary literally tripled, and everything. So this is the power of putting in the work. This is the power of believing, right? Imagine being out of school for almost a decade and then pass your NCLEX exam, right? So I just want to encourage you, especially for those of you that are in that boat where you may feel discouraged in your journey. Anything is possible if you believe that it is. All right, so let's go over some more how to master self-occupied questions. So take a look at this question on the screen. It says, which of the following actions, if made by the student nurse, are examples of primary prevention? Select all that apply. Okay. This one kind of hard, huh? Okay, I don't see any answers, so let me see. Oopsie. If you guys are, oh, okay, there. Maybe I can see it now. Okay, so, all right, there goes the answers now. I couldn't see it. So 2, 4. Oh, you don't know what PPD is? Okay. 1, 2, 4, 6, 2, 4. 2, 4, 6, 2, 4. I think that was the previous one. All right, 2, 4, 6, 4. Oh, thank you, Jamie. Could you help me too, Choma? Oh, Shara, yeah, absolutely. Yeah, just stay on to the end, Shara. Oh, thank you so much. I'm just now seeing the comments about Corinne. Man, I'm telling you, you guys, yeah, she was actually in a car accident too while we were studying, and she still pressed through. And I was like, are you sure you want to take the test? And so I was like, wow, that's amazing. Okay. You have to believe, like I said, you have to keep going no matter what, you know? You're Filipino too? Okay. Virgin March 2016. Okay, no worries. We got this. We got this. Am I saying your name correctly? Shira? Or Shira? Just put it out for me if I'm saying it wrong. Okay. All right. Great job. Yay. Okay, so let's do this answer, okay? Let's do this answer. You're so welcome. Okay. All right. So, I'm an emotional person. So I unfortunately, I tend to get emotional often. It's really who I am. I think because I'm just very empathetic. Okay. So I'll start reading the testimonial, start crying all over again. Cause I'll remember like how it felt when they passed and how they felt when they came to me, how discouraged, defeated, sad. People are very depressed when they meet me. Very, very, very depressed. And it's just a blessing when like you're the reason why they are smiling and they can take care of their family now, so okay, so with the choice started, 1, student nurse administers a PPD test for employment. 2, the student nurse administers a flu vaccine. 3, the student nurse administers a cyclovir to a patient diagnosed with hep C. 4, the student nurse gives a presentation on diet and exercise. 5, the student nurse gives Bactrim to a patient with a UTI. 6, the student nurse prepares a sterile field for cleaning the inner cannula of a tracheostomy. So there's actually 3 types of prevention. There's primary prevention, there's secondary prevention, and there's tertiary prevention. And essentially, it's doing interventions that prevent a active bacteria or virus from occurring. So there's different levels of it versus like when you get to tertiary prevention, that's where they already have the disease, but the condition, the virus, whatever it is, and you're giving them like antibiotics or something. So there's different stages as far as like what we're preventing. So this one, the best answer is and then you have to look at the question, you have to go through the keywords. So this one, the best answer is going to be 2, 4, and 6. 2, 4, and 6. Because primary prevention is like the first like layer, I should say, like because like they don't have any sickness, but you're doing steps to prevent it from happening. So every time when we go and get the flu vaccine, that's primary prevention. When you go and get like a pneumonia vaccine or like somebody that's older, that's primary prevention because we're preventing the possibility of something happening. A PPD test is confirming something that's already there, right? So because a PPD test, it's secondary prevention. Like, so if, for example, if you do the test and it shows that they have TB, then they already have TB. And then now we can start to do treatment. But then when we give Bactrim and cyclovir, that's tertiary prevention because they already have whatever the sickness is. We're just essentially giving them the drugs or the antibiotics so that way they don't, it doesn't get worse, like it doesn't go into like septic shock or something. Okay, so that's why the answer is 2, 4, and 6. Let me show you the answers one more time, then go back. All right, so 2 was give the flu vaccine. 4 was do a presentation on diet and exercise, because the goal is to teach about that. So that way they'll eat healthy and they won't get like diabetes and hypertension, etc. And then 6, because you're setting up that sterile field to clean it to reduce the incidence of infection. Okay, so that's why it's 2, 4, and 6. Hopefully that makes it pretty straightforward once you learn it. All right, here's another one. The phone triage nurse answers a call from a client who reports being bitten by a deer tick. Which instruction does the nurse provide? Which instruction does the nurse provide? Select all that apply. So we have 1, see your healthcare provider if you have malaise or feel achy. Malaise means like tired or fatigue. 2, come into the clinic now for stat lab work. 3, you need to start treatment with an antiviral drug immediately. 4, deer ticks are not carriers of any diseases affecting humans. 5, look for a red circular rash at the site of the tick bite. So here's the correct answer, okay? So it's going to be 1 and 5 only. 1 and 5 only. So 1 was see your healthcare provider if you feel malaise or feel achy. 5 was look for red and circular rash at the site of the tick bite. So here's why it's just 1 and 5. So early signs of Lyme disease include the bullseye rash, the fever, the malaise. Those are all early signs. Remember yesterday we talked about early versus late? And then late signs would be paraplegia, numbness, pain, and encephalopathy. Blood tests are not immediately reliable. It actually takes 6 to 8 weeks to get a result. So if you get one too early, it's going to be false negative. So that's why the stat lab work is incorrect. And then Lyme disease is treated with antibiotics, not antivirals. And then it is transmitted to mice, dogs, cats, cows, horses, deers, and humans. All right. And then, the last one is a typo. Okay. So you see that? So, so that's why it's just 1 and 5 only. TB, then it's 1, 2, 4, 6. Oh. Okay, I can see what I can see what you're saying, Maria. But for this question, where that question is referring to, I would say specifically primary prevention. Then treatment is doxycycline. Let me see. Yeah, I think I want to say that's correct. Doxycycline, yes. 1, 2, 4. Okay, so there's a few answers for this one. Okay. Okay. All right. So here's the next one. Did I do this one with you guys yesterday? I don't remember now. Maybe I'm thinking about something else. Did I do this question with y'all? Oh wait, no, I'm thinking about with my tutor, my students. See, I'd be forgetting y'all. I'm sorry. Because I was like, I remember I did this question with a student that I was tutoring yesterday, so I forgot. Okay, so it says, when providing care for a client who reports to the ER immediately after sexual assault, which nursing actions are appropriate? Select all that apply. Okay, so let me see what y'all put. Oopsie. Ah. Okay. Let's see what's in the comments. 1, 2, 3, 1, 2, 4, 1, 2, 5. Did we? I don't remember. My bad. I apologize if we did yesterday. I'd be like in somewhere else. Okay, so we'll just do it because it looks like a lot of people aren't familiar with it though. I was like, did we do this question? Did I do this with y'all? I was trying to remember. Because I had another student, so sometimes I'm like, I couldn't remember. But it looks like a lot of people don't know it though, so it's okay. Okay, so all right, thank you. Thank you for pointing it out. I appreciate it. We didn't? Somebody said we didn't though. It's okay, it doesn't matter. It's okay, we'll learn again and we'll learn twice then. It's fine. Thank you for pointing it out though, I appreciate it. So for this one, yeah, I feel like I did this. Well, no, I think I went online to do this. Oh, it's okay, forget it. All right, so see y'all, it's COVID brain. I don't know. I mean, my memory sometimes be off. Okay, so remember that we're always mandated reporters as nurses. So you do have to notify the police if something like this happens. But it says the person says offer support. Yes, we should do that as a nurse. Absolutely, that's appropriate. We should provide care for the injuries because that's what nurses do. We restore and recover. But 3 says to them sign a consent form. That's not appropriate. You would never make a client that just experienced an assault sign anything. You do need to contact the law enforcement though, because they need to be notified. Because like I said, we're mandated reporters. And then it's not appropriate for you to determine whether it was consensual or not. That is up to the police department, but that's not appropriate for us as the nurse. So it's just 1, 2, and 4. All right, 1, 2, 4. The last one says it is never appropriate to question the client about this assault or in any way apply that the client may have been at fault. That's the reason why you don't do number 5, because whether you're saying, however you may be saying it, it still could apply that. Okay, so 1, 2, and 4 only. So pay attention to the keywords, because like as nurses, it's easy to look at the previous one with the consent form and think, oh yeah, we need a consent form, absolutely. But you have to also remember too, it's the keyword says make, which means force, right? Which sounds very forceful, especially if they just experienced an assault. All right, let's do this one. As a nurse, you're preparing to transfer an adult patient who is 72 hours post-operative from surgery back to a long-term care facility. Which of the following should you include in the transfer report? Select all that apply. And then you know what? If you can check to see how many questions you're getting right and wrong. I should have told you that at the beginning. Check and evaluate how many you're doing so far. Okay. All right, so we have A, patient's vital signs of the day of admission. B, patient's medical diagnosis. C, the type of anesthesia that was used. D, patient's advanced directive status. E, any needs for special equipment. So for this one, remember it's saying that you should include, and they've already been in the hospital for at least 3 days, and now they're going to the long-term facility. So we don't need the vital signs of the day of admission, right? We need the vital signs right now, but not on the day of admission. We do need the medical diagnosis, absolutely. We don't need to know the anesthesia that was used because that was 3 days ago, right? It's not important now. We do need to know their advanced directive status. That's very important. Are they full code? Are they code blue? Full code. Are they DNR? And we do need to know if they need special equipment. So the best answer is B, D, and E. B, D, and E. All the other choices are not relevant, right? Everything else is not relevant. So here's a key word on NCLEX exams questions is time. All right, remember that when you get questions and it puts time, 72 hours, 1 day, 10 a.m., whatever, treat, like you have to pick that, you have to look at the answers based on that, because that's very important keyword to pick in the correct answer. All right, so time. That's why yesterday I talked about early versus late symptoms with dumping syndrome. All right, let's do this one. All right, it says an RN is attending an interprofessional conference for a patient who has sustained recent C6 spinal cord injury. The patient was a construction worker. Which of all members of the healthcare team should also participate in the planning care for this patient? Select all that apply. Okay, let me see. I can't see the answers that you guys are putting. Okay. A, C, D, A, D, E. Okay, A, D, E. Oh, okay. A, B, C, E, A, D, E. Okay, so I saw lots of A, D, E, A, C, D, E. Okay, all right, good. Okay, so let me walk this one through with you guys. So this is important because it's telling you they had a C6 injury. So for the exam, I do recommend that you look at everything from C1 all the way down to the lumbar and be aware of what dysfunction, how would it change whatever they would normally be able to do for the sake of the test. So this one, the correct answer is going to be A, B, D, E. A, B, D, E, all of them except for the speech therapist. So if you didn't know, so the first one, they need a psychologist because they used to walk around and be a construction worker. They can't do that anymore. So they're gonna need mental health therapy. A vocational counselor is pretty much a counselor that will help them find a new career. So vocation means like career, job. So because they're not gonna be able to do the same thing as before. They're not gonna be able to go back to that. They don't need a speech therapist because the speech is not affected at C6. All right. Swallowing speech is not affected at C6. And then they do need a physical therapist, absolutely right, to help them with ambulation and movement. And then they will need an occupational therapist because they're gonna have to learn all over again activities of daily living, so they're probably gonna have some possible defects there. So that's why it's A, B, D, E, and just not C. You didn't choose vocational because it was a recent injury. Oh, I see what you're saying. Well, let me answer. Let me put it like this. Because it was a recent injury, that's the reason why you didn't choose it. Well, think about this. It says here that it's asking us, the following members of the healthcare team should also participate in planning care for this patient. So that means who's everybody, who's all the personnel that's going to be involved in the recovery, whether it's short-term or long-term for this patient. Because it says planning of care, right? The psychologist is not going to come. They could see a psych in 3 days and they could see a psych doctor in 3 months, 6 months. It's a process, right? So that's why, and I see what you're saying, because they just had an injury, so they're not going to go back to work right away, but they're going to need to make money at some point, right? So it's talking about whether it's short-term or long-term. It's not just limited to just like right now, even though it uses the word recent. Does that make sense? So that's the reason why it still would include that. Okay. You guys learning something? You guys enjoying this? I just realized that, wow, this is great, huh? Okay. All right. So, okay, so now we're gonna do this one and then we'll switch it up. Okay, we're gonna switch it up in a little bit. So take a look at this one. It says a nurse is teaching a nutritional class to a group of females. Which of the following should the nurse include as risk factors for developing osteoporosis? Select all that apply. A, obesity. B, cigarette smoking. C, family history. D, inactivity. E, hyperlipidemia. Okay, let's see. I'm gonna show y'all the answer. All right, so let's see what y'all put. Okay. A, B, D, E. All right, let me go up. All right, A, B, D, A, B, C, D, A, B, C, D, A, B, C, D. Okay, so different answers. All right, A, B, D. Okay. All right, so here's this one. B, C, and D. B, C, and D. All right, so the choices were cigarette smoking, family history, and inactivity. These are all risk factors. Okay, so because cigarette smoking may increase the risk of osteoporosis. Also, osteoporosis tends to run in families and tends to occur more in those who are inactive. Weight-bearing exercise should be discussed as primary prevention measures to decrease the risk. Weight loss instead of obesity can lead to a decreased intake of dietary calcium and vitamin D, also leading to the development of osteoporosis. And then hyperlipidemia is not a risk factor. All right, it's not a risk factor. So B, C, and D. Okay, good. All right, you know what, let's actually take a quick, you guys mind if we take a quick 2-minute break? All right, so go use this moment for a second to use the restroom, drink some water, and then we'll start in like 2 minutes, okay? So just let's just take a quick 2-minute break, and then we'll continue where we left off at, okay? So don't go anywhere. Just use the restroom, grab something to eat real fast if you need to chew on something, and then we'll be back in 2 minutes. Okay, all right, let's continue. All right, you guys doing good? You guys doing good? You feel like you're starting to learn why you were struggling with static questions? Hopefully you are taking notes and applying information, right? Okay. Okay. Okay, so let's do a case study like question. Let's do a case study like question. Okay, so and I post this question on Instagram as well, this case study. I want to go over it with you guys and see how well you guys can do with this. And what you're going to do is, so typically what I would do like in a class setting, like through a meeting, is that we would actually do like a breakout session and like go over the case study with your groups, and then we'll come back and then do it together. But we don't have time to do that. So instead, we're going to do it all together collectively on here. So if the question says you have a 50-year-old male client who has been admitted for a chief complaint of upper abdominal pain, nausea, and vomiting, and his primary care physician is ruling out a medical diagnosis of acute pancreatitis. So you want to ask yourself, one, because you have to think critically, because this is what's going to happen for the next gen NCLEX. The way that's going to be presented is you'll have like a statement like this. It'll probably be even less wordy actually, but it will be like a statement, and then it will be like all these notes, and the notes will describe their medical history, their vitals, their labs, and then you have to pick out in the case study questions like what's pertinent, what's relevant, what's essential, all that type of stuff. And so by doing case studies now, it forces you to start thinking like that and start understanding the material better. So the first thing you have to ask yourself is, what questions would you ask during the collection of his health history database pertaining to the chief client? Tell me what you think in the chat box. They have acute pancreatitis. What are some questions you would start to ask them? Because they have acute pancreatitis, right? So remember, they have upper abdominal pain, they have nausea and vomiting. And so the doctor wants to rule out acute pancreatitis. Okay, alcohol abuse, good. Recent infection and history of alcohol, good. Frank pain or radiant pain to the back, awesome, good, okay, perfect, okay. Now, what about labs? What lab tests would you expect to be ordered? What type of labs will we order because of their condition? CBC, C-reactive, WC, CBC. Think about what's happening. They have acute pancreatitis. CBC, urinary. Okay, I saw your answer now, Alicia. So alcohol abuse, pain and duration, enzymes. So what type of enzymes? Liver function, good. Glucose, okay. CBC, bilirubin. All right, we're getting better now. Yes, good. Amylase, okay. CBC and urinary, pancreatic enzymes, trypsin, lipase, okay, perfect. Okay, good. This is good. I'm liking these answers. Okay, what about diagnostic test? What diagnostic test would you expect in order to confirm they have acute pancreatitis? Biopsy, okay. Ultrasound, good. Be specific. What type of ultrasound? CT of the abdomen, good. Very good. Perfect. Abdominal, there you go. Yes, that's right. CT scan. Yeah, so I'm gonna tell you what the answer is. I'll tell you what the answer in a minute. Okay, sure, I'm sorry. Okay. So which diagnostic procedures would you expect to be ordered? All right. So they have abdominal pain, they have nausea and vomiting, and they have acute pancreatitis. Okay. What would be the client teaching like, right? So the fourth question is, what is the client teaching? So what do you need to tell the patient? What education do they need? And then what are at least 3 nursing diagnoses? 3 nursing diagnoses. All right, so questions you would ask them: labs, diagnostic procedures, client teachings, and nursing diagnosis. So no eating, okay, good, okay. Glucose, NPO, acute pain, altered nutrition, pain, NPO, I see that. Acute pain, monitoring, no laying flat. All right, okay. Okay, so let me show you what they are. Let me show you what they are. NPO, nutritional, okay. Good, okay, awesome. Okay, so let me show you what they are. Let me show you what the answers are. So remember, so they're 50 years old, they're having abdominal pain, upper, and they're throwing up, and we want to make sure, we want to see if they have acute pancreatitis. So the first thing is that we would ask them as far as the collection, when did the pain start? When did the nausea and vomiting start? What were they doing? What are they eating or drinking? So is there anything that triggers it? Like, for example, certain foods can trigger fatty foods, spicy foods. Like, what is there specific foods that trigger it? Is the pain associated with the nausea, or does it occur without it? Is the pain with the nausea, or does it occur without it? If there is pain, where is it located, and does it radiate? If there is pain, where is it located, and does it radiate? Because that would tell us, based on where the pancreas is in the body, right? Where the pain that they were describing. Are there any foods, medications, or activities that aggravate or relieve the pain, nausea, or vomiting? Are there any foods, medications, or activities that aggravate or relieve the pain, nausea, or vomiting? Right, so these are all the type of questions that you would ask them. And then as well, the labs, amylase to see how much the pancreas damage is. Lipase, so whoever put that, very good, because it's usually elevated with acute pancreatitis. Glucose as well, because that's also going to be elevated. Why? Because remember, the pancreas contains insulin, and so that's the one that's in the beta cells of the pancreas. So if the pancreas is damaged, then the insulin will be decrease the production, which will cause the glucose to go up. And then WBC, because they're going to have a higher indication of inflammation or infection. So good job to those that got correct, right? So these are the specific labs, these are the ones that you would want to order. Amylase, lipase, glucose, and WBC count. Those ones would be the most relevant to rule out acute pancreatitis. And then as far as diagnostic procedures, you would do the ultrasound to assess for the presence of gallstones, particularly like an abdominal ultrasound. You would do a CT of the abdomen. That helps to assess. So CT is two-dimensional. They're different as far as what it sees, what it evaluates. And it will help to assess the size of the pancreas, any signs of fluid or necrosis. And then you would do an abdominal X-ray. And that will help to assess if there's stones or fluid accumulation in the area of the pancreas. So as far as teaching, what would you teach the patient? So you guys are right, good job with the NPO. So pretty much if it's X-ray, there's nothing that they do for X-ray. There's no special procedure for that. But if they're doing abdominal ultrasound of the abdomen, they have to clean out their abdomen. So that means they need to be NPO. So good job. Stool, gas, and air can alter the transmission of the sound waves and can cause altered recorded images. So that's why they have to be NPO. CT of the abdomen will require the client drinks approximately 42 ounces of contrast media prior to the test. So when they do a CT of the stomach, they have to give them contrast. I don't know because I never tasted it, but I smelled it when I gave it to patients and it smells weird. So they have to drink it because it's going to help to like bring the, like illuminate the abdomen under the CT machine. And then they also need IV access because sometimes we may give them the contrast as an IV push. So these are typically like the tests that they'll do to confirm if they really do have acute pancreatitis. And then the three nursing diagnoses, we're gonna do pain, right? That's a big one. Pain, risk for altered nutrition, less than body requirements because they're throwing up, right? They're having nausea and vomiting. So they're gonna have risk for altered nutrition, less than body requirements. And then the other one is risk for fluid volume deficit. So they're going to have fluid volume is going to be drop or low because once again, they're throwing up, they're vomiting, etc. Did somebody get all of them right? Did somebody get everything correct? Or at least one thing of everything? Right? So the last one, like I said, I know I did see some of y'all put pain, which was good. So anytime you see nausea, vomiting, diarrhea, any of that stuff, always think impaired nutrition, altered nutrition, right? Fluid volume deficit, because they're losing electrolytes, they're losing food. Okay, good. So I saw acute pain, good. All right, so yeah, did somebody get all 5 of them correct? That one's a little bit harder, right? So you see how the difference though with answering these type of questions, with answering or like doing this, how did you feel when you were doing these case study question or this case study question versus when we were just doing like the multiple choice or the SATA? What did it feel like? I kind of want to get an idea. How did you feel as you were doing this? Because since these were open-ended, this is something open-ended. And remember, this is similar to like the NCLEX, as far as like the next gen. You prefer the case study to SATA? Okay, no, which one? No, it wasn't. Which one is no, it wasn't, Maria? More critical thinking, yeah. I need to know more content, yeah. It wasn't too bad, yeah, not too bad, right? Because this one wasn't as bad because I gave you prompts, right? So for example, I gave you prompts where I told you, okay, they have this issue going on and this stuff. Now, okay, what would you ask? What would be the health history? What would be the labs? What would be the diagnostic tests, etc.? You don't like case study? You don't? All right. You don't want to take the next gen NCLEX? Okay. You're not good for that. I don't like the case studies. You prefer choosing options? Yeah. Okay. You have a very hard time with open-ended questions. Yeah. Yeah. See, yeah, it's different. I know. I know. Yeah. We need pass before April. Yeah, I know. Yeah. So it can be very, it forces you to think more versus giving you now the difference though with the next gen though is that instead of it being like the way I showed it to you, because this is supposed to challenge you to start to think more differently, right? Oh, NCLEX is better, I know. but the difference though is that once you take the next gen, it's going to give you a ton of information I just told you right now, and then you have to decipher what's correct and what isn't correct, what's essential, what isn't essential. I think there's one that it asks you to put it in like unessential, essential, etc. Will you get the whole question wrong if you miss the answer? No, from what I've read is that they're saying that you'll get partial credit. You get partial credit. More critical thinking. That's hard because I'm not good at deciphering. Okay. Okay. Yeah. So yeah, it's going to be way more information. And then now it's trying to see if you can evaluate the correctness of that information. Okay, good. Okay, so here's some additional tips I want to recommend too, especially for those of you that are taking your test within the next couple of weeks. If the question gives you like a diagnosis, right, or whether it's like in the question or some other questions, a lot of times you have to learn how to replace the diagnosis. So what I mean by this is that sometimes when you'll get a question, the mistake that people do wrong is that they assume that the diagnosis in the question is the answer, is what it's referring to. So meaning that it may say the patient has a history of a heart attack, but now they're having X, Y, and Z symptoms. So now you have to be able to pick the correct answer based on, you have to be able to evaluate, okay, what's the new diagnosis? What's the new complication, right? So essentially what this is saying is that, okay, when you look at certain practice questions, sometimes it will give you a diagnosis, but then if it tells you new symptoms, there's a new diagnosis. And then you have to be able to do that critical thinking and be able to identify what that is. So you have to ask yourself things like, what's the complication of the disease, right? What's the complication of a procedure? What are the side effects of a medication? So a lot of times When you see questions that mention a medication and it says, oh, patient's having these symptoms, it wants to see if you recognize the normal side effects, or it wants to see if you recognize the adverse effects. So when you guys get to like pharmacology, we start to review pharmacology, you have to pay attention to side effects versus adverse effects. There's thousands of medications to know. I know it's not possible to know every single drug, but if you can prioritize the most difficult drugs, or the most common drugs, then from there, focus on, okay, what does the drug do? For example, beta blockers, or drugs that treat patients with COPD, right? What do the drugs do? And then also, what's the side effect versus the adverse effect? Okay. All right. And then a few other things too, as far as certain tips. Oh, we're not done yet. There's still more to go. A few testing tips I want to give, especially for those who are taking your tests, within the next couple of weeks or so. Don't second guess yourself. I know a lot of you do that, but don't go back and forth, because you're more likely to get the answer wrong. If you do that, go with your gut, get some rest the night before, keep track of a list of strategies in front of you when you're doing practice questions. So for example, what we went over this evening, where I went over different practice questions or different strategies with you, organizing that into a list, and then do that when you're doing practice questions. And then do more questions during the last 2 to 3 weeks of your exam. More questions doesn't mean that you don't do any content, but prioritize doing more practice questions during the last 2 to 3 weeks of your test. All right, so these are some strategies that you can implement that will help you to correctly answer the questions and help you to think more critically and more naturally. All right, so these are some of the references from what I went over this evening. So what we covered so far, we talked about how to master SATA questions. We went over some of the different SATA questions. And then also we went over some additional tips, how to prepare for your test day. So I want to ask you so far, did you find this helpful today? Did you find what I went over tonight helpful? Did you learn? I know there was like a lot of different things that we talked about. But comment below, let me know if you found this helpful. I know it's late for you guys over there on the East Coast, so I'm trying to be mindful of the time. Okay. Yes, good, very helpful. Awesome. Yes, good. So helpful. Oh, good. And for those of you that are wondering about the replay, I'll talk about the replay at the end. If you didn't, like, you'll get the replay if you ordered it. So I'll upload the replay for all of you guys that wanted to get the replay, and I'll add the slides too. All right. And I'll add the slides as well, so that we can get the slides too. Okay. Okay. So one more thing, if you want me to help you to pass your test, if you want me to help you pass your exam, put yes, me in the chat. Okay. So like, if you want this experience to continue, you don't want to say goodbye, right? You want to keep this going. Go ahead and just put me, come help me. I want your help. Yes. Show me what you can do. So go and put that in the chat if you want to continue work together. Me, yes. It's improved your, oh, good, Nicolene. Oh, improved your way of answering questions. Good. Yes, help us. Okay, awesome, good. Stellar instructor. Oh, thank you so much, Jamie. Am I saying your name right? January, we're starting. Good. Yes. Awesome, Sherry. Good. Yay. Awesome. Perfect. Okay. So here's how I can help you guys for those that want additional help. So I mentioned this yesterday, but I'll go into more depth about it. And starting next year, so if you're taking your test within the next couple of weeks, then this might not be relevant to you. But if you are thinking more long-term, because you recognize I need more than just a couple of hours or few hours or whatever, I really know I need extended time, then this is for you, right? This is what you're looking for. So I have what I call my School of the NCLEX Mastermind program. It's a private program where I only work with a few people to help them to pass their exam, because I really dedicate and give a lot of energy towards my students. Because I really want everybody to succeed. And my philosophy is, when you succeed, I succeed. That's the only way it works. When you succeed, that's when I succeed. So I love to see people prosper and do and win, and like, you know, the testimonies I shared with you earlier and yesterday, those are just like just a piece of the pie, you know. So it's a 9-week program. It's actually going to be starting January 26th. So for those of you that are taking your test sooner, then, you know, I hope you still enjoy this experience. But if for those of you that want more time, this is going to be your opportunity. This is the program where I'll be helping with students and working with them one-on-one, as well as also in a group setting until March. So you will get access to all of the materials I have immediately. So this will allow you to, for those that registered this evening, actually, you'll get access to all the portal right away. So you can start studying before the class starts. So that would be really awesome, because then you can start reviewing the content and getting familiar with everything, you know, before we have our first class together. And then hopefully you can take your test before April 1. You know, I've literally had students that have taken their test before the program finished and passed. You know, but the goal would be ideally for you to take it before April 1. If not, I'm going to prepare you to take it after April 1 too. So either way, it's fine. So we're going to be meeting Thursday, January 26th until Thursday, March 23rd. So it's going to be on Thursdays, okay? The times will actually be from 5 to 7 p.m. Pacific. So around the same time that we met tonight, just a little bit earlier. And then 7 to 9 Central Time, and then 8 to 10 Eastern Time. So the way I do things is that a lot of the people that I work with or that come to me, you guys all have lives. You know, you have family, you're married, you have children, you have kids, you know, you have to work. And so the challenge for a lot of students, especially students that have been out of school for a while, or whatever the situation looks like, is that you find yourself having to take time off of work, you know, weeks. So, you know, that's very inconvenient, because then you have to not only spend the money that you spend to study and prepare for your test, but then also you lose that time from work. So the advantage of what I do is that it gives people the flexibility where not only is it online, so you don't have to drive somewhere or pay for gas or whatever, but because it's all convenient in one place, online, virtual, etc., it allows you to still like continue your daily life, you know, and just work your schedule around this. So each week we're going to go over each of the fundamentals to help you to pass your exam. So the first week is going to be all about understanding patho, right? So like the way that I just went over yesterday, we talked about the disease processes and etc. That's what we're going to go over in the first week, helping you to understand patho, helping you to better grasp it, especially when it comes to the test. Every class, it's content and then questions. Content and the questions. So it's going to be like a mixture. For those of you that were here yesterday and today, it'll be like a mixture of what we did yesterday and then what we did tonight. So content, questions, and then in between the classes, you have homework, you have assignments, and then also you will also have access to the portal where you have to review content. Week 2, all about physiological adaptation. So we'll go over diseases, disease processes, some more. Well, week 3, we'll go over, this is maternal health, peds, right? Especially if you feel like you struggle in that area. Then week 4 will be all about drugs, so pharmacology, case studies, practice questions. Week 5 will be safety, infection control, case studies, practice questions, and then week 6, psych. Week 7, management of care. Week 8, reduction risk potential, and then week 9, basic care and comfort. And then you have a final exam that you have to take, like a final assessment, to evaluate if you're ready to take your test or not, right? So every single week, if you notice, all of it is based on a category on the test, right? So that way we cover everything. So no matter where you're at, no matter whatever your, what's the word I'm looking for, a weak area was, where you got on the last test, etc., we're gonna knock all of it out. And the advantage is that because you also have the portal, you can move at your own pace, and you can move as fast or as slow as you want to. So that's why some of the students honestly go on and take and pass their test even before the class is over, because they still have the portal where they can go through the content, and then we meet during the class. So you'll have access to the portal. This is what it looks like inside. And it'll be a live online portal where, like I said, you can go through the material. This is where I go over more content review. So a lot of visual aids, PowerPoints, etc. And I do, on average, expect the students to study at least 10 to 15 hours per week if you're intentionally trying to pass before April 1, all right? So the people that's like, oh, I need to pass before April 1, that's your ideal time frame as far as how much time I recommend to study in between, not including the time that we meet during the class. All right, and then if you have any questions, just give me to the end. I probably will answer all your questions as I'm going through everything, but I will definitely answer questions at the end as well. Okay, so we'll go through that. So especially like I said, you'll have access to the portal where you'll go through the content in addition to the time during the class. The story I just shared with you earlier about Corinne, it was the same type of schedule with her. And she spent a lot of time making sure that she went to the portal in addition to the live time as well. You also have access to clinical training videos. So what I've done is because I know that most of the people that come to me, you've been out of school for several months, years, etc. So I put together a playlist, and this is like a medical skills playlist. So for example, it will show you, it will be videos on like how to put a Foley in, how to put an IV in, how to do stoma care, right? So this picture is showing you like a video where I was breaking down different type of skin infections and skin ulcers. That way it's more hands-on, more real, because obviously we can't all go to the hospital and hang out at the hospital together, and touch the patients, etc. But what I can do is I can make it as convenient as possible and put everything you need in one program, and essentially like provide for you the clinical skills that I've already approved for you to watch, review, and learn from. And it's going to be information that you already will see on your exam. The program has more than 50 assessments, quizzes, and exams. So that includes everything from cardiac to comprehensive to pharm to psych and etc. You would be fine going through this program alone as far as your questions and question bank, but if you want to use outside questions, I don't discourage it, right? But the program does have like a pre-test, a pre-RN and LPN test for those taking the LPN as well, a midterm test, and a post-test, like a final assessment test. And then every student that's in the program, I do look at your results, and give you feedback and input based on how well you're doing. You also get over 1,000 PDFs. So this is PDFs, study guides, study tips, cheat sheets. So like there's a pharm cheat sheet, there's another one, the study disease guide, I put that in there too, but the cheat sheet version, I put like over 1,000 PDFs in here. So that literally, and then also a lot of the guides are going to be like things to help people with study tips on how to learn, how to memorize, like how to recall information, things that you probably don't realize are affecting your ability to comprehend the material. So I put all that into different guides that I formulated for you guys. And then I also create what you call different types of clinical scenario assignments. So what that means is, like, for example, I'll give you an assignment and I'll tell you, okay, I want you to find a patient that has this and this, and you're going to ask them these questions. And that will be to help prepare you for the test as well as the real world. In addition to that, so in addition to the time that you meet live as well, you also have, like in the group setting, we also will meet one-on-one too. So there'll be time, at least 2 sessions with myself only, one-on-one, where we'll meet. During that time, when we're meeting, we're doing a couple of things. Either evaluating and assessing where you stand, what you need to focus on, what you're missing, etc. Also personalized study recommendations. And then if you want to really be, you know what, Neshama, you went over this in the last class, but I wasn't certain about it. Can you go over it with me right now? Absolutely. So I'll also dedicate time to tutor you privately as well during that time too. And then if you need another session, I will throw that in there. Like, it's not really a big deal. Because like I said, I really pour into the students in this program. And then spiritual insights if desired. So what that means is that this is only if you want it, like, and everything. But pretty much what it means is that I myself am a woman of faith. I'm definitely a Christian. I don't hide that at all. And so sometimes, honestly, when I'm talking to people, I realize that there are things that people are experiencing spiritually that's making it difficult for them to be successful. So like I may, if you want me to, I may give you advice. I may encourage you, as well. So because I realize at the end of the day, to pass your exam, we have to deal with the whole you, not just how to study, not just do a bunch of questions, but like we have to deal with the whole you. Some of you may have trauma, you may have things that you've gone through. A lot of people honestly have told me over and over again, I'm so discouraged, I don't even want to pick up a book again. We'll talk about that, because sometimes you honestly may just need a listening ear, somebody to listen to you and point you in the right direction. We'll do case study questions during the class. So remember how I mentioned earlier about the practice questions, etc. So we'll go over more case study questions, but there will be more next gen like. So I showed you in this picture here, the kind of like the model that they implemented. Well, this picture right here is like an analysis, like a step-by-step, starting with the clinical judgment measurement model. So I'll teach on that. I'll teach you about the clinical measurement judgment model. We'll go over the 8 steps of clinical reasoning, what that means, and we'll talk about how to break down questions, nursing process, how to answer priority questions, all that really, really fun stuff, right? But that will teach you how to think more critically. And then, like I mentioned, you will also, in addition to the time with the live class, you also have the portal for 9 months. So you also have the content, everything in the portal as well. And the portal has over 200 plus hours of videos, all the PDFs I mentioned, all the questions I mentioned, everything. So you have all this content review in addition. So that way you can still go as fast or slow. And then you have enough time to like review the material. And if you need more time, you have it for a whole 9 months. And then all the students that's in this program too. So all the physical books that we have, and any new books I create, right? Because right now I'm working on another book actually. All the students in this program, you get all the books for free. So it will be included. You just have to pay for the shipping based on wherever you live. And so right now we ship to US, Canada, Nigeria. I'm working on adding other locations as well. But everybody that's in the program will get all of our physical books as well. So it's about 4 or 5 books. The body systems book, the 70 diseases book, the farm book, the EKG book, and then I'm working on putting together how to slay the NCLEX book. And then also another book called Welcome to the Mastermind Program. You will get a welcome kit as a PDF, but you also get the physical copy as well. All right, so all you have to do is just cover the cost of the shipping so it can be delivered to you. So that in itself is like more than $200 investment by itself. And so essentially, like I mentioned, it'll be nine weekly 2-hour group live content review classes, coaching calls, you get all the replays, PowerPoints, weekly accountability, worksheets, homework, the clinical videos, over 5,000 practice questions. We also have a private WhatsApp group too. So in the private WhatsApp group, that's where I message and communicate with you guys as well privately. And then also we send notifications on there. There's also a Facebook group too. And then also all the students as well, you'll get a certificate of completion. So what that means is that when you're done with the program, you'll get a completion showing you that you completed the program. So for some people, you need some type of proof for whatever reason. Maybe it's your boards. We will print one out that will show that you went through our program. And then also the meetings as well, like I mentioned earlier. So you'll get that private time with myself. It will be 2 or 3 meetings. So whichever one that you, no more than 3, but at least a minimum of 2 meetings with myself where I'll meet with you privately, one-on-one to help you as well, give you customized review or tutoring if that's what you need. So who is this for? So this is pretty much for people that want to pass their exam, that want extended live guidance. So maybe you were or were not thinking about taking your test this far away or something, or studying for this long, or whatever you were thinking. But if you want reassurance, if you want, that support, then you're probably in the right. I know you're in the right place right now. It's for individuals, whether it's RN or LPN. So we do also for LPN. I had students that's passed with this program that took the LPN and also RN as well. Also, if you're ready to make an investment and you're willing to put in the work, because you do have to put in some work. It's not where you just show up to the class and then boom, you pass. I wish it was, but that's not nursing at all, right? Nursing school, I remember my nursing school involved, not only did I have to attend the class, I had to attend clinicals, I had to, do reading assignments, I had to, et cetera. It's going to be work. So it's going to feel like you're really back in school. That's probably one of the number one things that people tell me when they go through the program. They feel like they're really back in nursing school all over again. The goal is to help you to pass your test by April 1, right? But like I said, we will go over some case study questions throughout each class to help you to prepare if you end up taking it after that. I don't want you to, but I want you to be prepared if that does happen. I want to show you some quick testimonials, this testimonial. So one thing as well in the program, every student that goes to the program as well, you'll also be able to email me privately. So if you have like questions or you need support or something like that, you'll be able to email me privately and I'll be able to send, like in between the classes, I'll be able to give you advice. So I'm just showing you, I hid all the information so that way you can see, too much details and everything. But this is really somebody that I was helping to pass her exam with, and she had to retake her test, unfortunately, twice. She sent me her results via email. I looked over her results and everything. I went over it. I told her, I replied back to her email. I told her, okay, this is the reason why you didn't pass. You need to do this, this, and this. Okay. And then also she had access to our materials as well. So then I literally just got this email yesterday. So you see how it says that December 1? That literally is yesterday, for real. So I literally just got this email yesterday and she said, "Hi Choma, I reached up the NCLEX on Monday and passed. So excited, happy, and feeling all the emotions. God is so good. Thank you for taking the time with me and giving me encouragement during this journey." All right. So that's another really powerful testimonial that literally I just got this email and I was like, oh my goodness, let me share this with you. I need to tell people about this because this is another powerful testimonial. So that's another thing as well. It's just so much personalized support. That's the biggest thing from this program, because you can go through a lot of review programs and they can tell you, here's content, here's questions, here's strategies. But the issue though is that, what do you need though? How should you study differently? What should you focus on? That's the difference. You need somebody to tell you, to be like a mirror and tell you what you should do for you. And that's why people get such results. This person, she literally passed after getting the help. It was literally 2 months. 2 months that her life changed after not passing her test before. So maybe you're probably wondering now, okay, how much is this? What does the investment look like? So let me go over that with you today. So as far as everything in the program, because this is a premium program. This is something where, like I said, I work with you privately, independently, or privately, in addition to the live group, in addition to everything else that you're receiving. So with the program, the live version, I know for some of you, this is probably going to be like way more than you're anticipating, but it's a mastermind program. So it's going to be like more of a intense experience. So just the live version by itself, without all the other things I included, is a $21.97 value. All right, $2,997 value. Then the private sessions is $1,997 value. And then the portal, the actual portal itself, that's $12.97. And then the assessments, questions, PDFs, cheat sheet, books, that's $11.97 as far as the value of everything. And I will say, I know it could probably seem like, oh my gosh, like this is so crazy. But one thing I will tell you, because hopefully you were here yesterday and everything with the first day of the review, is I've been doing this for a while, y'all. I've been doing this for a while, and I know what I'm doing. You know, I say that humbly, you know, and I've helped so many people. And now I'm at the place, though, honestly, where I don't just do this. You know, I also help. I work with businesses. I have a marketing agency. So I do a lot of different things aside from this. I'm also a minister. I'm also like I do a number of different things. So when it comes to me, the reason why it costs much is a lot more with me than it would be for you to go to like tutor.com and Google any tutor is because you're not working with just a person that's just like a RN and then I do this on the side. No, I'm fully deep in there. And then in addition to that, I'm a CEO, you know, so my time is way more valuable than the average person in this, in the, not as if I'm better than anybody, nothing like that. But as far as like I have, because of the way that my time is, and because I serve thousands of people on a regular basis. So the total value is 7,482. That's not the cost of the program. That's the total value as far as like everything you're getting, because it literally is like a 1 year access to everything. Now, as far as the price, the regular price, believe it or not, this program was $5,000, right? And we have students that paid $5,000 to be in this program and passed with this program, right? The discounted price is $2,750. That's the discounted price, okay? However, though, instead, what I'm doing is that for those that register, so if you want to register, you feel like these past 2 days was really, really helpful, it taught you a lot, and you know that this experience could be like steroids for you. So if you want to register, it's going to be instead $2,000. Now, don't worry, I do have something up my sleeve I'm going to share with you in a minute, all right? But it's $2,000 if you want to be a part of the School of the NCLEX Mastermind program, where you're going to receive this level of intimacy, support, review, content, teachings, etc. So I do offer a payment plan, and I do offer different financing options as well. So there's either the option of $2,000 or there's 4 payments of $550. Now, this is an early bird price, actually. So this is not even what the price is going to be once the new year comes. So that's the advantage of registering now versus later. And I'm offering essentially, because based on what the price would normally be, because it would normally be the $5,000, this is 60% off discount, which will expire at the end of tonight at midnight. So if you want to be a part of this experience, that's what the rate looks like to get everything I mentioned, and including as well everything from the books, the support, the portal, the questions, the 9 months access, the 9 weeks, the tutoring, the private tutoring, all that good stuff. All right. So after tonight, the price will be going up. So after this evening, I will be raising it up to $2,750. So it will be increased price, or you can do 4 monthly payments at $750. Now, if you're already thinking, there's no way I can do that, don't worry. We do offer financing options, okay? So I only have 10 spots available. So this is the difference. You can go to another review, spend maybe $400, $500, right? And it's like 100 people in the room, and nobody knows who you are, right? It's not a customized, personalized experience. The instructor will not spend time with you and teach you and tutor you and tell you, hey, do this instead. Hey, this is what you're missing. That's not going to happen. And they're going to intentionally allow hundreds of people to be in their program, and you have to catch up with, the crowd. This though is intimate. This is private. That's why there's just 10 spots, right? So I know it's not for everybody. Okay, I know it's not for everybody. I know that it's not for everybody. That's okay. I still hope that, like I said, I still hope that you found a lot of value from being a part of this experience, these 2 days, of this free time and everything, of learning the content, etc. Okay, so we have multiple financing options available. So we actually have incorporated now buy now and pay later options. So that will allow you to literally pay at your own pace. and that will like cut the payments like significantly. So you can literally, it's almost like you can set it up where you can do like pay later with PayPal. We have pay later with Shop Pay. Like I've literally made a decision to be very intentional about providing financing options. So this will allow you to literally stretch out the payments as much as you want. If you know there's no way you can afford like to pay that lump sum amount or to pay that payment plan amount, we created different financing options available for you guys. So if you want to learn more, if you want to register, you can go to this link. I'll put it in the chat really quickly. And then I'll go over in a minute, I'll go over any questions you have. But you want to go to bit.ly/NCLEX mastermind program. All right. bit.ly/NCLEX mastermind program. And I'm going to put it in the chat so that way it's convenient for you guys. And I'll go over some more of what's in the program just so you can learn more about what it is, and then some more of our testimonials, and then I'll answer any questions that you have. All right. So hopefully as I'm teaching everything, it will answer all the questions you may have about the program, the price, everything. Okay. So then the next thing too, right? Like I said, if you want to, I just put it in the chat right now, bit.ly/NCLEX mastermind program. So here's another testimonial. This is Rachel. Rachel, single mother of 3 children. Single mother of 3 children. She signed up for this program. She paid for this same program. And she got started and everything, right? Single mother, 3 children. She graduated from nursing school in 2013. And after she passed on the 4th attempt with the program, this is what she told. She said to me, because I asked her, oh my gosh, Rachel, okay, tell me how the program helped you, you know? And she said, I graduated nursing school in 2013. Starting all over, learning the content, knowing where to begin was a challenge, right? But the modules, so the portal actually, the modules provided help to me quite significantly, right? So she passed, single mother, 3 children, right? This is Abosidi, all right? This is her on the left. She went through the same program as well. She said, hello, Nurse Trema, how are you doing today? I have good news. I wrote my NCLEX RN on Monday, and I just checked my result. I passed at 85 questions. Thank you so much for everything. I'm so happy. I pray that will be your testimony, that one day soon you will email me and you will say, Nurse Trema, I have good news. I passed my exam, and it will be you sending me an email that you passed your test, right? So this is a Bosidi who passed her RN exam, okay? Then I also want to remind you too, because I know it's easy to look at your current situation and feel like, oh, I don't know, I really can't do this. Try not to forget how nursing has changed. Nursing is not the same that it was 2 years ago. The pandemic changed everything, right? So now, especially in the US, the rate for becoming an RN, because hospitals are so desperate, is so high, right? I've seen now $70 per hour. Literally nurses are making $1,000 per shift. So a day, right? So your income, just like that, can triple, double, whatever that looks like for you within a couple of months, right? And you have to consider, what you have to consider is you have to think about how much money are you losing from not having your license, right? How much money are you losing every single month? Money that could go towards your kids' college fund, money that could go towards you going back to nursing school, money that could go towards you buying that new house, that new car, that new, whatever that looks like, paying down your debt, paying down debt in your debt that you owe, and etc. Right? So that's one thing to consider. Also, as well, right? When you think about this, honestly, with the value that I'm giving you with this program, and the possibility on the other side is like huge, because literally, look at this right here on the left, on the right hand, what I highlighted. Do you know, I literally went online, I went on Indeed.com, and I just typed in the word 10K sign-on bonus. RN, right? Even LPN. I typed in the word 10K sign-up bonus. I saw so many 10K sign-up bonuses. 10K bonus, 10K bonus, 10K bonus, 10K bonus, right? So that's another thing I want you to also consider as well, is that the power of the transformation, of the shift, of the acceleration, where literally now you go from making whatever you're making right now, where now you can apply to $10,000 sign-up bonuses and literally make back your investment in what, a month, right? Not even. So that's the thing I want you to also consider as well. All right. So once again, if you want to register while it's at the rate that is right now, go to the link bit.ly/NCLEX mastermind program. All right. And then I'm going to play another testimonial, and then I'll answer any questions that you have. So I'm going to play this one really, really quick. This is Thomason. So Thomason, she went through the program as well. Okay. And she was struggling to pass her exam. One thing that she told me is that after she went through the program and passed her test, she was finally able to sleep at night. All right, let me play this for you real quickly at the very beginning.
To go, what would you say your biggest challenge was prior, to starting?
To be honest with you, my biggest challenge then, in fact, I do not even know my biggest challenge until I met you.
Okay.
I did not know my biggest challenge because I don't know where I was missing it.
Yeah.
So I'm just like, I don't know what, I knew something was wrong, but I don't know what was wrong. Okay. So I was missing what was wrong. So until I met you, that was when in fact, the first time that I did my interview with you, you asked me one thing about what is CHF. I will never forget. And I was like, it was like I was dumbfounded. As in, I was looking like, like someone who have never heard of CHF. And I was like, oh my God, as in, this is bad. Now I told my husband, even after, I said, this is so bad. As in, someone asked me what CHF, and it's not that I do not know CHF, but at that moment, my brain was blank. Yeah. So I said, now this nursing thing, when someone asks you anything or when you see a patient, it means you should know what it is before they even started giving you the signs and symptoms and history and everything.
What would you say are the 3 things that you feel like you got the most from the overall experience of the program? Like, what were the main things that you feel like made this difference for you to pass?
How do I put it? I think, having this one-on-one interaction and being able to break it down this way, because like I said, I didn't know where I was missing it, but until I had that encounter with you, that first encounter, that what is CHF, that made me first of all know, okay, point number 1. I didn't even know it was a content thing. I was just like, you do not know CHF. How will you be a nurse that you will know it? Mm-hmm. So when you...
Okay, let me go to the next one. And then it's another one here. All right, I don't want to make it too long, otherwise we'll be on here forever. But this is Tiffany. She passed her RN exam on the 3rd try with the program. She said the program was easy to understand and the hours were not too long, nor did she lose interest. So once again, if you want to make an investment, if you want to get started, you can go to the link that I posted in the comment, bit.ly/NCLEX mastermind. This is Nezha. She went from scoring 39% on average on her UWorld exam scores, 39%. So she's told me, she sent me a message. She told me, I'm struggling. I'm a foreign graduate. What do you think I should do? I did the UWorld. My recent score was 39%. She signed up for the mastermind program. I told her, let's get started. Let's meet. Let's do everything. And after 6 weeks, she sent me a message, said, hi, Ms. Choma, I passed the NCLEX. Thank you so much for your help. All right. So she passed literally 6 weeks later after going through the program. I have another one as well. This is Etsy, passed after 8 times. All right. She passed her LPN exam after 8 times. Over here on the right is Shinda, who passed her exam. She finally passed her RN exam. And I want to say it's been several years actually. And the biggest thing that helped her was going through all the strategies of the program, as well as also the time that I spent with her, because I spent a lot of time with her actually, to helping her to better understand the content and the material. And this is Ovella. She said, thank you so much. Thank you for your help, Ms. Choma. I really learned so much from your program. I still listen to the videos, but if anything, I just have to go and take another course, breeze through. I must say you have really helped me answer the questions. I've been weeding out the weeds. One thing for sure, I'm not getting distracted, to be honest. I really don't think if I didn't go through your program, I don't know what I would understand now. You're the first to say, learn the content and preach that to my friends as well. Thank you again. Okay. So, and then I'll say who this is not for. If you're set on taking your test within the next 8 weeks or less, then obviously, but if you feel like in your heart something is telling you to do this now, then this is a great opportunity. Like I said, there's financing options, there's buy now, pay later options, where you can literally pay as little as $180 to get started, as far as like with the financing options that's available. If you feel like you can pass the test on your own, then, and obviously it's not for you. And if you graduated within the past 6 months or less, then it's probably not ideal for you as well. What happens if you don't pass? Here's the great thing about this program, that even if you don't pass with the program, we do have, you will have access to every single review I do for a whole year for free. So I'm committed to you being successful. Because like I said at the beginning, your success is my success. So every 4-day review, every live review, every workshop, every class that I teach, you will have access to all the review classes and the replays for free, and you have everything for up to a whole year until you pass your test. You will have to show though that you studied at least 75% of the program. So because one of the things I've noticed is that the people that are successful with our courses are the ones that went through the material. Because sometimes people will get anxious and like they will just like study like maybe like 25% of the program and like go take their test because they want to hurry and get their license. But you do have to honestly go through the material, that's where you're going to see the most amount of success. Okay, so I'm not gonna play this one because it'll take too long, but you can go to this link here, bit.ly/NCLEX mastermind program for more information. And you can also see all the testimonials on there, because there's like a ton more. I mean, like so many testimonials are on that page, even before and after results are on that page, as far as people that failed and then passed. Another one, Elaine, she also as well emailed me, messaged me and everything. She got on a webinar like this. And then she told me through email, she said, I'm happy to email you today to let you know that after doing your 9 weeks dedicated to your course, I'm officially an RN. I took the test 4 times, didn't know what I was doing wrong. And then after discovering your free webinar and investing in your program, I finally passed the 5th time. I gained a better way to look at the test and learn whatever it takes to learn and have confidence in my decisions. Thank you so much for believing in me and my abilities, and have so much to look forward to in my RN journey. With love, Elaine. All right, so if you're ready to get started, you can go to that link, and then let me go ahead and see what type of questions you guys have. All right, in the chat. Okay, sorry, I'm just now seeing everything now, so let me check. All right, you're welcome. Thank you, Nicolene. Oh, really? Oh, I helped you come closer to God. Oh my gosh. Oh, that's wonderful. Thank you for telling me that. Wow, you saw the prophetic prayer? Oh my gosh. Wow. Well, God bless you. You're welcome. All right. Any questions about anything I shared so far? Let me see if I can make this screen as well. Let me do like this instead. All right. And if you decide, for those who are joining, I'm so excited to work with you. I'm so excited to help you. It's going to be a total blessing. Like I mentioned as well, I'm only offering the 60% off discount at this rate until midnight. After midnight, I will have to raise the price again. Okay. All right. Let me see any questions that you guys have. Awesome. Let me see if I missed anything here. Oh, here we go. Can you please tell me about the NCLEX RN assessment? Oh, okay, sure. So you have, the RN, so inside the program, so here's one of the things. When people come to me, one of the issues for a lot of students is that you don't know what you don't know, right? And a lot of times there's things that people don't realize are hindering their ability to succeed and to pass their boards, okay? And so what I did is that I created an assessment. So my assessments are my own thing. So what that means is that I evaluate what are all the elements that I've seen over the years that keeps people from not passing the test, and I put into assessment. So the first assessment, the pre-test, it will ask you everything from content review to strategies, but it will also ask you questions that will help me to understand, what are some other issues that you may have with when it comes to like for example, are you struggling with critical thinking? Are you struggling with retention? When did you finish school? Just different things that you may not be aware of is making it hard for you to study, and so and I've even had students that have gone through the course and found out that they have dyslexia. Some people didn't realize it, that they had a learning disability, and that's why they couldn't pass their exam. So after we realized that, we took like an assessment test. So I have different assessment tests that helps you to evaluate that too. We took an assessment test. They realized that they have dyslexia, and then I gave them the specific advice and resources for dyslexia. Guess what? They went back and took the test, and now they passed. So the assessment test, the one I have in the program, the first one is a pre-test to evaluate where you stand. And then I have multiple, it's like over 50 of them. I have multiple assessments that evaluate based on different areas on the test. So then it's going to be like cardiac assessment, psych assessment, endocrine assessment, etc. Then farm, then comprehensive. So I don't know if that answers your question, but it's different types of assessments. Oh, okay. Okay, good, Shara. Yeah, well, I'd love to work with you, Shara. Sorry, I'm just not catching up with the comments. Okay, so that's different, Sophia. Yeah, that's different. Send me an email instead, and I can go over it with you. Yeah. And for those of you that wanted to watch, if you want to get the replay, you didn't get it before, you can go to the link that I mentioned on the screen as well. So that same link, so for the 2-day class, these past 2 days, you can get the replay as well. But for those that join the program, you'll also get the replay to this class as well too. So it'll be included. All right, good. Can I start it now? Yes, absolutely. You can start it right now, and you'll get access to everything immediately. So when you start today, you get access to everything today as well. Okay, and then also if you want to, for people that start today, we can do one of our sessions before the class starts. So you have to, you can always tell me though if you want to do that, but you can literally do the session before the class starts. Oh, you're taking it in February. Okay, I'm like literally scrolling up now to see all these answers. Okay, good. All right, awesome. Okay, so here's my email. Let me send you the email. Info. I put it on the screen too. ChooseNursing.net. I also want to ask, what if I can't join the live class because I work evenings too? Oh, that's fine. So every single class is always recorded. Yeah, so even if you can't make it live, the classes are always recorded. You're welcome. And then also as well, so you get the replay so you can go back to it. And then when we have our one-on-one time, I can go over with you whatever it is that you missed or wanted to learn. Yeah, so hope that answers your question. All right, you're welcome. All right, any other questions? Let me drink some water too. And then what I will do too, for those that came in today and you missed it, I will send out the replay temporarily. So that way you can watch it but it will be only day 2 for free. So those that bought the replay, you'll get both days lifetime access because you'll be able to download it right away. And then the students in the program, you also get that too, and you'll be able to download it right away. But I will allow everybody to watch just day 2, and I'll send it to, I'll try to send it out like as soon as possible. All right, and then you'll be able to watch that for like a few days though. So that won't be like the same as everybody else that that purchased the replay. Okay. Okay, sounds good, Shara. Well, I'm so excited to work with you. Awesome. All right. Okay. Okay, all right, alrighty. Okay, I don't think I see any other questions. So we'll go ahead and wrap it up. If you're joining right now, if you're trying to sign up right now, then let me know. If you need any help, I'll stay on a little bit longer just to make sure that you're not having any issues. But I really hope that you guys enjoy this experience. Um, I'm really looking forward to working with you. You know, this is by far, I'll tell you, the best decision you can make for your life. This is probably one of the best decisions. I can't tell you the amazing types of feedback that I gotten from this program, and like just things that people have shared, how much it changed their life, their soul. Some people honestly go through this program and get healthier. I know it sounds like, I know it's like, wait, that's not the NCLEX. Yeah, some people join the program and they get healthier, because in the portal as well, I have a whole section on how to like different types of changes you can make in your health when it comes to even being healthier. Because one thing I noticed, I did a study on this because I like to study, and a lot of students, the reason why you struggle with retaining the content is because there's stuff that you forgot. Um, and there's things that you don't realize, like for example, your diet, what you eat makes it harder for you to retain information. So there's certain types of processed foods that actually, based on research, shows that it affects memory cells, it affects retention. So a lot of the students in the program as well have told me that their eating habits have changed, they're exercising more, they're healthier. Like I know it's insane, right? Because it's like, this is about NCLEX stuff. But like I said, I deal with the whole you, not just, one aspect of you. So a lot of people, they end up getting healthier in their bodies just because of the program, because I teach you, because I also provide what do you call it again? Insight with like how to change your diet so that way you can remember things better. And then also one thing as well, everybody that's in the program, I also give them like supplements for free, like health supplements. So like the live program, not the other programs that we have, but in the live review, the students, I send them supplements. That's what we did in the last group of people, the last cohort. I mailed everybody supplements. So these were supplements, like for example, to help them stay awake, like energy drinks, natural base, vitamin C. And it was really significant too because it was during the pandemic. So I sent everybody like supplements, all included. It's like, it's not, I pay for the shipping and everything. And I send that to everybody as well. So that's another advantage of being a part of this program too. All right, well, I don't see any more comments. I don't see any more comments or questions. If I did miss you though, please don't hesitate to email me. The email was info@choosinnursing.net. I will probably won't get to the email tonight, but I'll check it tomorrow morning. Okay, so I'll check it tomorrow morning. So thank you again. I'll work on getting the replay up as soon as possible to those of you that purchase the replay. So you'll get access to it right away, and I'll let you know. And then also everybody else, I'll send you the replay, just day 2 only for free, but it will only be available for a few days. The people that bought the replay will get it for lifetime access. So that means that you'll be able to download everything immediately, and then you get all the slides and all the PowerPoints. If you still want to purchase the replay, go to the same link, bit.ly/NCLEX Mastermind Program, bit.ly/NCLEX Mastermind Program. All right, you guys, God bless. Have a wonderful rest of the night. I'll talk with you guys soon.